Welcome back. This is Yasser Wasifi from Learn Dental Series. In this episode, we will continue to discuss the adhesion and adhesives in restorative dentistry, especially adhesion to dentin. Let me remind you about my disclaimer. I don't receive fees, compensation, or royalties from the sales of any of the products shown or discussed in this presentation. Also, the presentation has not been sponsored by any company, agency, or organization and is only prepared for educational purposes. This presentation is copyright protected and could not be reproduced, distributed, or transmitted by any copying, recording, or electronic or mechanical methods without prior permission of the author. Today, we will continue to clarify the rationale and the principles of bonding of both enamel and dentin. We already discussed in the first episodes the adhesive dentistry in general, how it is introduced, what are the important terminologies we will use, and what are the modes of adhesion, and what is the advantages of introducing adhesion to dentistry. Then we go forward for the adherent or substrate surfaces, which are the tooth structures including enamel and dentin. We started with adhesion to enamel, which was as simple as possible, more than that of dentin, as we reviewed the enamel structure including its histological structure and the chemical composition. The concept of adhesion to enamel was thought to be via acid etching, which entails selective demineralization of rods more than interrod substance that will result in creation of micropores. These micropores will be impregnated or infiltrated by resin, which will form microtags that will solidify, permitting intermechanical locking with enamel. And we translated this into clinical steps for adhesion of enamel, discussing in detail the specifications of acid used and timing of using it, proper timing. What are the clinical steps, including cleansing, including dryness, including bonding, until we get the required strength or the optimal strength of bonding with enamel. Then we shifted to dentin, reviewing its structure histologically and chemically, and clarifying the difference in chemical composition than that of enamel. And it had been shown that it contains more organic contents and lesser inorganic contents than that of enamel, and it seems to be heterogeneous rather than homogeneous when compared to enamel structure. Also, we discussed the problems encountered in adhesion to dentin, including its heterogeneous histological and chemical structure, also difference in mineralization that takes place according to age and from area to area in the same dentin of the same tooth, also the lowered surface energy due to its higher organic contents, and also we clarify that conditioning of dentin lowering its surface energy as it gives a chance to organic to participate in much percentage in its composition relatively. Okay, and also smear layer and its inherent intrinsic wetness are a great problems that encountered in adhesion to dentin and prevent to get the optimal adhesion of composite resin or bonded restorations to dentin. When discussing the principles and the clinical steps of dentin adhesion, we conclude that the theory of dentin hybridization is the most suitable one, and we started to discuss it, what is conditioning and what is priming. When discussing primer, we get a great problem, okay, according to the solvent of our primer. Is it acetone or ethanol based, or is it water based? The difference in its evaporization speed. The evaporization speed of acetone and ethanol is much higher than and faster than that of water. That's why we stuck to the problem. Should I let the dentin wet to receive adhesive or primer with ethanol and acetone based, or should I let it dry? We are confused now. Is it wet or dry? What is specifically do you need from the characters of dentin? Let us start to discuss this point where we stopped in the later episodes, okay, at this wet or dry dentin. We are confused, okay? Let us discuss something. Kanka and Wennett in 1992 assigned a strategy which is called wet bonding. What is meant by wet bonding? Wet bonding means that please let dentin structure wet after conditioning. Just pick up excess water, just use your high vacuum and pick up the excess water with cotton pellet or cotton pledges. Okay, in expense of you will use acetone or alcohol or ethanol based primer. Why? Because already they chemically dehydrate the collagen by substituting the water by acetone, which by in turn will evaporate, leaving the collagen microspaces patent and empty from any water. What about the collagen? Then it is dehydrated. Will it collapse again? No. Why no? Are you sure it will not collapse? Yes, we are sure it will not collapse, because while acetone is evaporized, your monomer is precipitated along the wall of your collagen fibril, stabilizing it in its expansion condition, expanded condition. That's why your micropores or microspaces will still patent and ready to receive your resin to be infiltrated and become a bondable substrate. Not only that, your monomer will arrange itself to react to the collagen fibril with its hydrophilic part, while the hydrophobic part will be away. Okay, this is what's called wet bonding, and you leave your dentin moist to avoid over dehydration of dentin. If you dry your dentin at this condition when using acetone or ethanol based primers, it will be over dehydrated because you already dehydrated and collapses the collagen by air dryness. Then further dehydration will take place while acetone or ethanol will be evaporized. That's why Kanka and Wennett in 1992 proposed the wet bonding. Just leaves your dentin moist to the extent that avoiding excessive dehydration of dentin. The disadvantages of wet bonding is that being quickly evaporated as acetone or ethanol based primers, that means that there is no time allowance, or your time will be insufficient to let your primer to go down to the whole depths of conditioned dentin or to the whole depths of exposed collagen. It may be, or it surely will be evaporated before complete wetting or complete priming of the exposed collagen and allowing its expansion. That's why when using acetone or ethanol based primer, you should apply it in multi-coats, not only one or two. It should be 3 and maybe 4 coats, and giving a chance for each coat without drying it, without accelerating the evaporization of acetone, because if you dry it using air, you are accelerating the evaporization of the solvent before complete wetting of exposed collagen. That's why you should apply it in multi-coat. The second coat will have a fresh solvent, which is acetone or ethanol, that will dissolve the lowered or the first coat again and dissolve it, that allow its flow down to the uncovered collagen, and the second coat will replace the first one, and the first one will go down. When you apply the third coat, it is the same. It will dissolve the second and a little bit of the first, and they will go down to wet much more deeper layer of exposed collagen. That's why, because its volatile nature, its rapid evaporization, you should apply multiple coats. Not only that, you should instruct your assistant not to dispense from the container your primer based on ethanol or acetone in a dispenser, because if you use it and let it for open air, already you will lose, due to volatile nature of acetone and ethanol, you will lose some of your constituents and it becomes viscous and it will not penetrate to enough depths inside your conditioned dentin and cover your exposed collagen. That's why instruct your assistant just to drop it immediately in your microbrush and apply it by yourself Okay, as an operator, apply it to your dentin in active application. Then let it for at least 30 seconds without any air dryness, because air dryness will accelerate evaporization of it. Okay, without any air dryness. Okay, for at least 30 seconds before applying the second coat, to give a chance for the first coat to go deeper as much as possible to cover the exposed collagen and to cover the treated or the conditioned dentin. Okay, again, as instructed by all manufacturer, advise or instruct your assistant to recap immediately your bottle or your container to avoid any evaporization of the content, because leaving your container too much time exposed to open air, that means that you are accelerating the expiry date of your primer bottle based on acetone or ethanol because of evaporization of the continuous. That is why if you use it frequently and open and recap it too much time, or more than once or twice per day, 1 or 2 cases per day, or if you forget to let it or to recap it and you let it for a while in open air, in the second application apply at least 4 coats, because already your coats haven't sufficient solvent. You lose it while you didn't recap your container immediately. This is from the clinical point of view. Also, the second problem in this strategy with bonding, that you didn't dry enamel and dentin, and you couldn't inspect proper conditioning of enamel and dentin, and you didn't have any landmarks that conditioning is sufficient. Why? Because dryness clarifying the efficiency of conditioning, as you could see enamel by naked eye, okay, it becomes chalky white frosty appearance or velvety appearance. At the same time, properly conditioned dentin appears dull. Here in this strategy, I didn't have any landmarks that I could inspect, improving that the conditioning is quite enough. I'm depending only the accuracy of applying my steps. That's all. Okay, but it doesn't appear either chalky white enamel or dull dentin. That indicates proper conditioning. In controversy to this is the dry bonding strategy. Dry bonding strategy, let us conclude the wet bonding. Don't dry before or after application of primer. In expense of your primer is acetone or ethanol based, and apply multiple coats. This is in brief what is called wet bonding. In contralateral to it is the dry bonding. The dry bonding means that, okay, after conditioning of dentin, you rinse and you dry it with air blast for 2 to 3 seconds. That will result in removing of water from the microspaces between collagens, that will result in collagen collapse. In expense of, you will use water-based primer. Unless you used water-based primer, please don't dry your dentin. Here you are depending on expansion and rehydration of collagen, depends on the water solvent, the water content of the primer. Depending also, water is not evaporated as fast as that of ethanol or acetone based primer. Then you will have sufficient time to saturate your collagen by water to re-expand. Then why you dry before you are applying this? To avoid what is called overwet phenomena that discussed in the last episode. Okay, to avoid extra dilution of your monomer of the primer that will globulate and forming blister-like globules that will occlude the microporosities created or clarified by the conditioning process, and will prevent the formation of a uniform coat of hybrid layer. That's why you will dry before applying water, and applying water-based primer, and applying a coat or maximum double coats. Not like that of acetone and ethanol. It should be triple or quadru coating, okay, 3 to 4 coats according to how old you get your primer, okay. Here is 1 or 2 coats for maximum. Depending on, it contains from 35 to 50% HEMA that will maximize the expansion of your collapsed collagen. But at the same time, it still contains extra water, and water solvent of this primer is not fast in its evaporization like that of acetone and ethanol. Then you are in need again to 2 to 3 seconds air blast to dry it. The disadvantage that the collagen fibers, you are not sure is it expanded all of the collagen fibers or not. That's why our disadvantage in this condition that we may have area of collapsed collagen. This area of collapsed collagen, okay, will prevent to get effective hybrid layer. There will be an area that may be devoid of priming and bonding and devoid of hybrid layer due to improper expansion. This is called hybridoid zone. Then your hybrid layer will not be a uniform. Okay, then to conclude this, if you have a primer based in ethanol or acetone, number one, don't dispense it in dispenser, okay? Just let your assistant dispense the drop on your micro brush immediately at the time of application. Apply it and let also instruct him to recap it immediately in order to not to lose much of your solvent that will evaporate quickly in the open air, okay? Let your coat to have sufficient time for infiltration into your conditioned dentin for 10 to 30 seconds at least, okay? Don't air drying your dentin either before or after application of primer. Before primer in order to avoid over dehydration, because already your primer based on acetone or ethanol will act as a chemical chaser, excellent chemical chaser that will remove water. If you already dry it with air and then further chemical dry it with acetone or ethanol based primer, it will result in further collapse rather than expansion, okay? Apply multi-coats. Don't dry the coats with air in order to never to accelerate its evaporization and allow sufficient time for coating, okay? If you used, this is wet bonding strategy, if you used water-based primer, then go for dry bonding strategy, which includes 2 to 3 seconds air blasting dryness before application of water-based primer. Apply water-based primer in active application. Give it sufficient time to infiltrate, also at least 30 seconds or more, okay? Dry it or accelerate its dryness, because the dryness of water-based primer is too much slower than that of acetone and ethanol-based primer, okay? Apply a second coat to make sure that you are re-wetting all the dentin, okay? Otherwise, there will be areas of devoid of coating due to collapse of collagen, okay, which is called hybridoid zone, that will result in with water-based primer, okay? Again, we didn't explain, is it wet or dry? Let me reply to this question that it is a wrong question. This is not the question that you should ask. You should ask the question in a form of how wet is wet and how dry is dry. There is a different degrees in wetness and different degrees in dryness, because if you left dentin over wet, even with acetone or ethanol based primers, okay, the coats you apply couldn't remove all the water or couldn't replace all the water. And if you let your dentin excessively dry when applying water-based primers, you will get hybridoid zones. Then there is a degree of wetness or a degree of dryness, okay, in between. There is a compromise in a wetness or dryness of dentin that is suitable to get maximum advantages and the maximum of bond strength to dentin. And that's why the highest quality of your formed hybrid layer. Let me discuss with you a common famous example. All the instructors and lecturers use it in this topic when discussing wet or dry dentin bonding, okay? Which, as you see this photo, it's a photo of a beach. If we close up a part of this photo, okay, like this part, you could notice 4 zones from left to right. The most left one is the sea or the ocean, the water itself. Then comes a layer which is heavily loaded with water, okay, which is called wet area. Then a lesser one called moist. Then a much lesser one is absolutely dry, okay. Usually the most favorable zone to be used by people entertaining at the beach is the middle one, which is the moist one. Why? Because the most left one, which is wet, okay, they couldn't enjoy the beach because of the water, okay. The water is too excessive, may destroy their tools, they may not enjoy the beach, okay, because water attacks them every now and then, okay, according to the sea waves, okay. The dry one also is unsuitable part or phase. Why? Because it will be too hot, okay, to enjoy the beach. But the middle one, which is the moist one, is the most suitable one, okay. It has a little bit water, okay, that let the sand to be firm, and at the same time with proper condition temperature that suits their activities. The same for us. We need dentin not to be wet, not to be dry, we need it to be moist. It's a compromised phase suitable for dry bonding and suitable for wet bonding. If we let the dentin absolutely wet, like the zone to the left, okay, then you will have no spaces to be invaded by your primer, and the amount of water in dentin will be much more higher than the ability of your acetone or ethanol solvent to be kicked away. And if you let your dentin too dry, even you will use the dry bonding strategy, but it will swallow all the water content to that there will be no effect, even if you used your water-based primer for 3 to 4 to 5 coats, okay. It will not re-expand the collagen, okay, as you expect, and it will affect the quality of your hybrid layer. So, leaving dentin moist in between, okay, by drying it using high vacuum suction and cotton pellets or cotton pledges, okay, this is the most suitable condition for ethanol and acetone based primer, okay. And if you will use a water based primer, just starting from this moist level and shooting it with 2 seconds only 2 seconds to 3 seconds maximum of air blast, it will be suitable for dry bonding strategies. Then leave your dentin moist in between, and according to your primer, okay, either deal with it as it is or just add a little bit, 2 seconds of air dryness. I hope it is clear. No, still not clear, okay. Then I will reply to you, identify your primer. This is the secret. You should read exactly the manufacturer instructions of your primer. You should define your solvent, and the primer solvent will already determine and identify the clinical steps you should apply to get the most effective and the higher quality hybrid layer and bonding with dentin. The bottle you see here, if you read the second line, okay, it contains ethyl alcohol. Okay, then it is alcohol based and it's volatile and it is suitable for wet bonding. Okay, let us again discuss it in much more details. Acetone based primer, it is an excellent water chaser suitable for wet bonding, but it evaporates quickly after being dispensed. That's why dispense it on your micro brush, okay, can evaporate from the container, leading to change in the composition, so you should recap it immediately. Apply in multiple coats, okay, to let every coat dissolve the previous one and get down to cover all exposed collagen network. Okay, this is acetone based. Okay, if you read it is ethanol based, then it evaporates less quickly than acetone, but much more faster than that of water. Okay, it provides good surface energy and good penetration and less offensive odor. Okay, its disadvantage is it is still suitable for wet bonding, but the main disadvantage is its extra drying time is still required, more than that of acetone but lesser than that of water. Still you are in need for multiple coats. Why we always mention that multiple coats are a disadvantage? Because you are increasing the number of steps, and as we mentioned before, increasing the number of steps give a chance or opens the door for extra mistakes. That's why we would like to reduce the number of steps, especially we are working inside a minute cavity. Its dimensions are large enough for us as a dentist, but if you describe these dimensions, let us say for civil engineer, he will laugh because he's dealing with kilometers. We are dealing with micro and nanometers. Okay. Third one is water-based primer. It provides slow evaporization but has capacity to re-expand collapsed collagen fibers, but by 9 to 50% higher than that of ethanol and acetone. It is suitable with dry bonding. Its disadvantage, long drying times that may necessitate air, and when we need air, we are afraid to recollapse the collagen again. Okay, it may interfere with the bonding if not removed probably, as it may lead to water tree formation, okay, and will lead to overwet phenomena. That's our primer. Okay, our researchers in a trial to cover these problems of wet or dry, at the same time in a trial to reduce the number of steps, they combined two steps in a one step. Okay, they combined conditioning and priming at the same time, and this strategy and these types of adhesives are a new brand or a new generation that will be discussed in full details under or within the episode of adhesives itself, which is called self-etching primers or conditioner. It's a group of acidic monomers that provides two action in one. It will condition the dentin and prime the dentin at the same time. This will avoid any left collagen exposed uncovered by monomer, because once you are uncovering your collagen, you are coating it with primer immediately. Okay, one after one at the same step. Okay, if you imagine the self-etching primer, it's a group of acidic monomers. Okay, it will not subject it to washing or rinsing. Okay, and it will not wash away your smear layer. Then it is partially demineralize your smear layer, penetrating it, but didn't remove your smear layer. It uses your smear layer as a principal component of your hybrid layer. then your hybrid layer will compose of partly dentin, including its smear layer. Okay? And that's why it will not open your dentinal tubule, and post-operative hypersensitivity will not be expected too much like that of total etch we discussed in multi-steps, where the conditioning step is a separate step, and you may leave a great chance to let your dentinal tubules open, not covered, and let your collagen open or exposed, not covered. But here there is no chance for that. That's why you will reduce the number of steps, you will reduce the number of mistakes. Once you opened or demineralized your dentin, it will be invaded and infiltrated by the monomer of your primer. Okay, you skip the problem of wet or dry, and how wet is wet and how dry is dry. Okay, at the same time you counteract or you solve the problem of post-operative hypersensitivity that may result of multi-step procedure or total etch or etch and rinse strategy. This will be discussed in full details what's called self-etching primers under the topic of adhesives in the next episode. This clip shows to you the difference between these different strategies. This is collapsed collagen after we conditioned dentin and we dry dentin. When we apply our primer, okay, which is water-based primer, you will notice how expansion of collagen takes place because it is already wetted by water, but actually there is an areas that could be left with overwet phenomena, okay, that will be left after that forming water tree, as you see, and will lead to failure of adhesive property. But when you are using acetone or ethanol based, okay, it will act as an excellent chaser, but you could notice that it doesn't have the ability to go down because it evaporates immediately. Okay, so you are in need for multiple coats. But for self-etching primers, okay, it reacts with this water, okay, if it is present, it is the water contents of dentin, okay, and immediately it exposes collagen and covers it. Okay, it doesn't remove the whole smear layer, but still it have a bonding strength within acceptable range. Okay, it is still, its bond strength is lesser than or weaker than multi-step procedure, which will be considered as the standard for adhesion to dentin, but still within acceptable range. Although it is lesser than multi-step, but it is within acceptable range. Please take this note that acetone and ethanol-based primer should be applied in multi-coats and left for self-dryness without additional air dryness. Don't accelerate its dryness. Each additional coat will dissolve the previous one, pushing it downward to cover deeper exposed collagen, while water-based primers requires additional air dryness before and after application to avoid overwet phenomenon. Here comes the last step to bond with dentin, which is resin impregnation or resin infiltration. These steps aims to seal all the microporous spaces created by conditioning, okay, and achieve a biological tissue which is partly formed of resin encapsulating and banding hydroxyapatite crystals and collagen totally. This is called hybrid layer. This hybrid layer is a layer formed due to resin impregnation or infiltration into dentin after dentin's surface conditioning. Hereby is a scanning electron micrograph showing composite with its characteristic filler appearance, okay, at the top of our scanning electron micrograph. Then comes the adhesive, and then comes the hybrid layer. This hybrid layer composed of resin impregnated inside dentin and inside collagen network in 3 dimensions, and this part thickness here starting from the letter H up down to the border, the down border of our scanning electron micrograph. This thickness is 5 to 8 or maximum to 10 microns, representing the hybrid layer thickness. Okay, when applying your resin or your bonding agent, the same as that for primer, please apply it in a uniform coat in active application to allow enforcing it inside your conditioned dentin, conditioned and primed dentin. Okay, and provide it with sufficient time to infiltrate, provided a sufficient time to infiltrate and impregnate dentin. Okay, it should be thinned enough to allow its flow, but don't air thinning this layer. Brush thinning, thin it with brush much more than better than that with air, because air may lead to also evaporization of some constituents, but not only that. Okay, air may lead to pooling of your layer at the corners of your cavity. Okay, when you push it with air, it may pool at the corner. When it pools at the corner, this will be a weak point that acts as a stress concentrating area full of resin. Okay, that will affect your restoration. Okay, at corners, at cavity corners. But the most important is the formation of oxygen inhibited layer by the action of air blast. Okay, as you know, all the monomers you used, okay, its polymerization is retarded by oxygen. Then the surface layer will be improperly polymerized, improperly solidified, and at the same time will not have enough free radicals to bond with the first layer of composite. Then when you thin it with air, you are decreasing the bond strength between this bond and composite more than between this bond and tooth structure, which is dentin. That's why it is better to thin it with your micro brush. Okay, give it a chance, at least 30 to 40 seconds to impregnate inside dentin, then sufficient light curing from all the angles according to the manufacturer instruction, and much better to be more than what is instructed. Suppose your manufacturer instructed you and tried to you to cure it for 10 seconds, okay? It doesn't matter if you cure it less than 10 seconds, but it is better to cure it much more than 10 seconds. Especially, you didn't exactly know how much the power get out of your curing unit. Your curing lamp, okay, when you get your device new up till now, it attenuates by time. That's why it's better to increase it, especially increase the time of curing, especially if you get an older device, okay? Because actually the total energy exerted by this device in 20 seconds is not exactly what is required by manufacturer. It will be sure less than what is required. That's why addition of extra time is advantageous rather than it becomes lesser. Okay, please know that bond strength to dentin will depend on the complete resin infiltration into demineralized dentin, including exposed collagen. The same as that for enamel. The bond strength of enamel to enamel is affected by to how extent dot bonding agent infiltrate inside your micropores, and we already mentioned that it is highly related to the pore diameter than that of the pore length. Okay, because the pore length, if it is much more, it seems schematically better, but actually clinically it may result in back pressure porosities that prevent complete infiltration of the resin into the pores of enamel. This is the same here. Okay, try to give a chance to your primer by applying multiple coats, and at the same time provide sufficient time to infiltrate and to impregnate your dentin, including the open dental tubules and the exposed collagen matrix to the proper depths. Okay, because incomplete infiltration or coverage of exposed collagen will result in a disaster in a form of denaturation of the exposed collagen, because any exposed collagen uncovered will be attacked by what is called matrix metalloproteinase enzyme, okay, that will distract it, resulting in bonding failure and post-operative hypersensitivity. That's why when applying multi-step or total etch, or what's called etch and rinse, separate steps, adhesive strategy, okay? And we are going to the debate of wet or dry and what is this, but you could expect a clinical problem in a form of post-operative sensitivity. This is due to matrix metalloproteinase, denaturation of exposed uncovered collagen. That means that you have uncovered collagen, okay? And this is expecting with multi-step etch and rinse strategy. For self-etching primer, okay, already you didn't open your dentinal tubule, you didn't expect to have post-operative hypersensitivity, but the problem is the acidity of these self-etching primers quite enough to etch enamel and bond with enamel or to deal with enamel? That's what we will discover in the next episodes when we discuss these in details. But in advance, I will tell you something. Is still there acidity to affect enamel and to get high quality bond with enamel? The group I'm speaking about, again, the group of self-etching primer, okay? Its ability to produce efficient bond with enamel is questionable, okay? And sometimes you are in need to etch enamel in a selective etching procedure, additional procedure, before applying this self-etching primer, okay? Especially in cases where you have a bulky enamel or when you have a virgin unprepared enamel, like cases of closing minor diastemas, okay? And if you don't etch enamel in a selective manner, okay, at this time the bond will be weaker at enamel surface that may result in marginal ditching and marginal discoloration. That's why there is no ideal restorative material or ideal restorative technique. You have a suitable technique which you get trained with it, and you have a critical thinking in treatment planning and skills, and in treatment planning skills and clinical applications of these bonding systems. Then, what are the causes of incomplete resin infiltration into dentin? Incomplete resin infiltration into dentin, like this schematic diagram. This is the resin, this is the exposed collagen, this is the whole layer you demineralized dentin, okay? But already your resin doesn't impregnate to the full depths. There is this area with white background of demineralized exposed dentin collagen uncovered. Why? Why your bonding agent didn't go down to cover the whole thickness, and the hybrid layer will be only limited to the upper half, okay? This may be due to over dryness that leads to massive collapse of the collagen. That's why we asked the question is not wet or dry, the question is how wet is wet and how dry is dry, okay? Or you may apply a single coat, okay, especially if it is acetone or ethanol paste that evaporates immediately, giving no chance to be withdrawn down to wet all the exposed collagen, okay? Or you already coated multi-coats, okay, applying multi-coats, but each coat haven't the sufficient time to properly expand your collagen. Then you apply multi-coats, but already you apply a coat and another without leaving sufficient time, as we mentioned before, at least 30 seconds to give it a chance. Or you may accelerate its vaporization immediately, okay? Although you are applying multiple coats, but each coat you are applying air, okay? That's why it evaporates its solvent contents, okay, without having sufficient time to wet all of this, okay? The same for resin bonding agent, okay? You didn't apply or you didn't allow for sufficient time to infiltrate into demineralized collagen fibers. All of these with multi-step procedures, okay, will result in post-operative hypersensitivity, and by the action of matrix metalloproteinase enzyme, this exposed collagen will be denaturated and destructed. That will result in post-operative hypersensitivity and will result in failure under the hybrid layer, which is called nanoleakage, that will be discussed under the topic of adaptation later on. Okay, let's conclude that we have this dentin surface that is conditioned, okay, with acid conditioner, okay, followed by application of primer, okay, and give it sufficient time, then apply bonding agent, okay, followed by curing, okay. Then you have 4 steps to bond with dentin, okay, or 3 steps, and the 4th one is to cure or to solidify your bonding agent. Number 1, conditioning by applying acid conditioner for 15 seconds, rinse for at least 15 seconds, and gentle dryness using vacuum and using cotton pellet or cotton blanket to pick up gross water or gross remnants of water. Conditioner is washed or rinsed. Then applying primers. Apply in multi-coat active application. Provide sufficient time. Leave it for self-dryness if it is acetone or ethanol-based primers, and help it to be rapidly evaporated by just 1 blast, okay, of air for 2 to 3 seconds if it is water-based primer. Then primer is allowed to dry, either self-dryness for acetone and ethanol-based primers, or gentle air dryness if it is water-based. Then coming the bonding agent, apply a uniform multi-coat, brush thinning of it, leave it for 30 to 40 seconds to infiltrate without any air dryness or air thinning, followed by light curing with sufficient light curing from all the angles. Then conditioner should be rinsed, okay, primer should be dried, either self-dried or with the help of a little bit air, okay. Then bond, which is light cured, okay. For self-etching primers, okay, you are not in need for the first step of applying conditioner and washing it. There is no washing, there is no rinsing. Just apply it and let it sufficient time for self-dryness or as instructed by your manufacturer, followed by application of bond and curing, okay. Don't forget this. Conditioning needs rinsing. Priming needs dryness, either self-dryness or by the help of air blast. Bonding needs light curing. For self-etching primers, okay, you are not in need for the first step, okay. There is no washing, there is no water, okay. This is a scanning electron micrograph showing to the left side your composite, then the adhesive and the primer, okay, a layer at the top. Then comes the hybrid layer, okay, including resin infiltration into the dentinal surface and collagen networks in 3 dimensions, and this is what's called hybrid layer. Please feel free to ask. Don't hesitate to ask me, as your questions are welcomed at any time. You could ask me or apply your inquiry by commenting to this video, and I will reply to you as soon as possible. Also, you could contact me via email or via any of the social media I regularly use, which is mainly Twitter, okay, and I will reply to you as soon as possible. Finally, thank you for assigning this time to listen to me. I hope you enjoyed it, and we will continue in the next episodes. What about the adhesives itself, okay? Please don't forget to subscribe to my channel. It is a great honor to me to be one of my subscribers, okay? And activate the notification to get every new updates, okay, of my episodes in Learn Dental series. Thank you, Yasser Al-Wasif.